Welcome to Let's Therapy, where we get real and raw about your mental health, faith, and blended family. We're your hosts, counselors Scott and Vanessa Martindale. Now let's therapy. Hey guys, welcome back to an episode of Let's Therapy with Scott and Vanessa Martindale. Before we get started, we do want to make this disclosure that if you are needing help for a mental illness, this is not a replacement for therapy or counseling. We do suggest that you contact a local counselor, or if in an emergency, please dial 911 or 988 to identify a trained professional that can help you. But today we're going to dive into a pretty sensitive topic that honestly people just don't want to talk about, which is teenage suicide. Mm-hmm. So I know you have some stats on this, Vanessa. Kind of walk me through what you're seeing.
Well, you guys, I pulled this from UCLA Health, and this was from last year, and it was actually updated recently this February 23rd. Mm-hmm. So it says that suicide is the second leading cause of death among people ages 15 to 24 in the U.S. Nearly 20% of high school students report serious thoughts of suicide, and 9% have made an attempt to take their lives. And that's according to the National Alliance on Mental Illness.
Yeah, those stats are scary. And I know as parents, and honestly, we're parents of a teenager as well, this is something that we are at least acknowledging, but most parents don't want to seriously acknowledge.
Yeah.
The fact that this can affect your family. It is not necessarily a result of something that you have done as a parent. Mm-hmm. But nevertheless, we know that teenagers deal with suicidal ideation. I can remember a story, and I'll just kind of point this out, it was years ago or maybe a year ago that, our 17-year-old was in a situation where a friend of his had told them that he was she was contemplating suicide.
Yeah.
So not only is this in our lives, but it's also affecting our teenagers in areas that they are now coping with other people around them that are thinking about suicide.
Yeah.
So let's talk about some ways as a parent that you can start identifying, when there's an issue.
Yeah.
So the first thing that I would say is, your child. Mm-hmm. And when you see behavior changes or things that they used to really enjoy and they're detracting from it, know that there's a problem.
Yeah. And I would say some other things are, if you see signs that that their mental health, like if you're seeing that it's under attack, if you're seeing, like you just said, Scott, different behaviors, if you're, noticing, they seem less joyful or even the words. So, listening, even when your child is not talking, there are things that you can see and perceive and that's off. I would say, also friend groups. One of the things that our son has shared with us is that, it's popular to do things such as cutting and, and that there's actually groups where kids do this together and they do these behaviors, whether it's at a friend's house or I would say engage in, kind of dangerous activities, so to speak.
What you're referring to, there's actually two different types of disorders in the DSM, which is kind of like the mental illness kind of Bible per se, is there's suicidal ideation, and then there's also non-suicidal self-injury disorder. Mm-hmm. And they're two completely separate things, although I know most people will join them together. And we're going to talk about kind of the non-suicidal injury disorder just a little bit later. But like you said, changes in behavior. The other thing I would say is, as parents, you have to be willing to ask hard questions.
Yeah.
We are a society that really just moves at 120 miles an hour, really never focusing on the details. We're just worried about what's tomorrow hold, what meetings do I have, what's my child's school schedule. We're moving on to the next steps. So we forget to look at the details of the day-to-day and have those hard conversations of, hey, this is something that I've read, or this is something that has been talked about. Can you and I have an open, honest conversation?
Yeah.
Because I do want to point something out here. Mental illness, especially in teenagers, is not something that they actively pursue, meaning they're not trying to get to that position. It is an illness. It is something that affects people. So a lot of times they're they're thinking these thoughts and they don't want to think them.
Yeah.
But they don't know how to not. And they don't, in therapy, we've talked about this 1,000 times, it's not necessarily the most coolest thing to pursue. So they're like, well, I don't want to go to counseling. I don't want to be in therapy the rest of my life, but I'm having these thoughts and I don't know where to go with them.
Yeah.
So as parents, you got to be able to have those hard conversations like, hey, how are things going in your life? You seem a little distant, or you seem to not enjoy the things that you used to enjoy. Are you having good thoughts, or are you sleeping well? Kind of walk me through what's going on in your life.
Yeah, and I would say some risk factors for teen suicide. So some things that you could that can play into this. It can be having a psychiatric disorder or depression, anxiety, bipolar disorder, oppositional defiant disorder. Maybe there's a family history of a mood disorder or a family history of suicide or suicidal behavior. History of physical or sexual abuse or exposure to violence or bullying is another one. Substance abuse is another one. Exposure to friends or family members who actually have committed suicide. It can even be we get this a lot with blended families, trauma from the parents going through divorce or things like that. And so, there's a lot of different risk factors that can play into why teens, start feeling this way. And then, they're down this road.
Yeah. And we touched on the kind of the non-suicidal behavior disorder. A lot of times, and the difference between those two is, suicidal behavior is looking to end your life. Non-suicidal behavior disorder is you're doing things to have a release. So if you're very stressed, that's why cutting is one of those that's often talked about in teenagers. There are other more risky asphyxiation type techniques that people use. They're really just trying to do something to their body to feel a release so they don't feel the pain, the stress, the anxiety that they may have felt previous to that. And again, you mentioned it before. I think a lot of teenagers kind of group up and go, man, we can do this and we'll all feel better. Yeah. And substance abuse comes into that as well. But that difference is they're looking for that release of stress.
Yeah, no, that's good. And some warning signs that your teen might be suicidal. And this kind of goes with the behaviors, but it's even talking or writing about suicide. For example, I'm going to kill myself, or I won't be a problem for you much longer. Just even remarks like that, some undertones with the words they're saying, withdrawing from social contact, mood swings, increasing in substance abuse, changing normal routine, including eating or sleeping patterns, feeling like they're trapped or hopeless. These are all things that can be warning signs that your teen might be, having some suicidal ideation.
Yeah. And we see this a lot in, today's culture. We see this happening with people who have sexual identity disorder, people who are struggling in that area.
Yeah.
The other thing I would say is if your teenager has attempted suicide, the likelihood of them attempting again is also high. Usually about 25% of those who attempt once attempt again. So again, if this is a history for you and this is a history for your family, we want you to be on high alert. We want you to be noticing those behavior changes. We want you to be comfortable having those conversations. You as a parent have to step up in here. You have to step up.
Yeah.
You said it earlier. It's the second leading cause of death in that age group. So it's a problem, and we have to take notice. So we're going to talk about now what to do, how to take those steps. And I really want to kind of focus in on, a lot of people, teenagers say a lot of things for attention. I understand that. But this is something we don't and shouldn't play with. So first thing I would say is if you notice something, if your child maybe has that comment of, well, I won't be a problem much longer, or you notice these extreme changes in behavior and maybe you've had that conversation and they've said, yeah, I've thought about it. The first thing you want to do is get yourself with a licensed counselor. Now, depending upon the severity, you need to have that assessed.
Yeah.
You need to have that assessed. That's why counselors are very well trained in assessing somebody's suicidal ideation.
Yeah.
And then from there, once you find a counselor, and if you need help on finding a counselor, there's a great website called Psychology Today. You can go in there, enter your zip code, and you can find a counselor who is local to you. The next thing after you have assessed them, if the counselor feels, and we're talking about a minor here, if the counselor feels that inpatient psychiatric care is needed, they're going to tell you as the parent.
Yeah.
That, hey, our recommendation is that they go into an inpatient facility. This is a safe place for them.
Yeah.
So there's hospitals all over the country. They can go in and they'll do something, an 8 or 10-day program where they can kind of separate them and get them the help that they need.
Okay. Yeah. No, that's good.
Then afterwards, again, I would also recommend family counseling. This is something that's going to be traumatic for your entire family. You want to get around people who are supporting you in that area.
Yeah. No, that's good. And some, just to piggyback off of that, some of the things that you can do to prevent teen suicide is talk about mental health and suicide. You mentioned that earlier, Scott. Paying attention to their behaviors, the warning signs that we talked about, discouraging the isolation, monitoring and talking about social media use. We hear a lot of that, it's a lot of things stem from social media, the comparison, the fear of being left out, things like that. Encourage a healthy lifestyle. Support the treatment plan if they are seeing a counselor and their counselor has them on a treatment plan, and monitor any medications if they start taking medications to treat their depression or anxiety, things like that. Making sure that you're monitoring that and safely storing your firearms, your alcohol, your medications, things like that could be used as a weapon, so to speak, to carry out suicide.
Yeah, I'm glad you touched on that because I think a lot of people maybe don't think that many steps out. Yeah, if you have guns in your house or if you have availability for that, you definitely want to be safe. Overall, guys, again, our desire is to bring light to topics that people generally don't want to talk about.
Yeah.
So if you're listening to this podcast and you're raising teenagers or you have friends that are raising teenagers, the first thing I would say is, hey, don't be embarrassed. If you face this or if you're in this problem, don't be embarrassed. Mental illness is as real as any physical illness, and it can be treated, but we have to pay attention. We don't want to be the receivers of what we didn't pay attention to.
Yeah, and one scripture that I absolutely love that I want to leave us with, it's Psalm 147:3, and it says, he heals the brokenhearted and binds up their wounds. And I love that so much because I know that, teens or even adults that suffer with mental illness and suicidal thoughts, that we can call on the Lord and we can pray to him and reach out to him. And just believe and have faith that even in our brokenness and even in those dark situations or those dark moments, that he can bind up anything that we've experienced and that we're thinking about that's negative, and turn it into something good.
Yeah. Guys, this is, again, one of those podcasts we wish we didn't have to do, but I'm so glad that we did. I'm so glad that you listened to this. I hope that if nothing else, it alerted you to the situation that, hey, this is a possibility. No matter who your family is, this doesn't generally just affect, the low socioeconomic. It doesn't affect certain races or religions more than others. It is everywhere, and everybody needs to be aware of it. So our hope and our prayer is that you don't have to deal with this, but if you do, we want you to be prepared. Guys,
Yes.
Thanks so much for joining us for an episode of Let's Therapy. We will see you again next week.
Be blessed in all that you do.